Dear friends, I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And what a better opportunity to have a nice chat with you, to talk one-to-one, to be welcome at your home, at your workplace, at your car's radio, in order to have a one-to-one conversation about matters that are very important. They're actually a matter of life and death. That's how important they are. And what dismays me is all the tools we have to bypass, to prevent, to avoid the catastrophic condition that we're seeing with health in our time, and the very little that we do because we do not have a consciousness about it, because we don't fully understand the importance of it all. So please just lend me a little bit of attention for a little while, and you're going to see how important this conversation can be and how it can change the way you live and the way that people around you live, and the most important, how healthy you're going to be, and what about longevity. So let's talk about that, because this is very important. I'm a doctor, medical director of BioCare Hospital. I have been a doctor for over 50 years. I have seen a lot of things in these 5 decades, and I have seen a lot of sick people, unfortunately. But I belong to a generation that saw how things were shifting from one type of a problem to a different type of a problem. As a doctor, I began when antibiotics were the big hope of a new era in medical care, because we were coming after actually centuries of lost lives because of infectious diseases. I mean, tuberculosis and pneumonias and all these diseases were very common, and they were killing a lot of people. I mean, delivering a baby was a big risk. It was a gamble. Many women died after pregnancy because of an infectious complication that was not understood at the time. But as we learned about infectious diseases, and as we learned how to keep them out of our life and to solve the problem, we started looking not a light at the end of a tunnel, but as a bright future in medical care. We thought we had conquered it all, that we were going to live forever, and that we were going to be very happy, that we could do anything we wanted. Because women didn't die after giving birth simply because doctors started washing their hands. Sounds ridiculous, but that's how it all started. There was a British physician that proved that if the doctor washed his hands before delivering a baby, the chances of an infection went really down. And then we learned about, from that experience, a lot of things to keep things clean, to keep bacteria out of the scenery in order to prevent infection. But when antibiotics began, antibiotic therapy probably started at the end of the 1930s with the sulfa drugs. I don't know if any of you remember sulfas. And then antibiotics, penicillin and everything. I give you a little piece of history. The man who discovered penicillin lies at the Westminster Cathedral. Why? Because his discovery changed the whole world. Just one single medical product, penicillin, changed the world. It actually was instrumental in making a lot of the Allied armies be a lot more victorious and successful, because soldiers didn't die because of infections. So that changed the world. And that is the world into which I arrived as a doctor. I'm talking the 1960s. So antibiotics had been developed. We were having excellent results with them. We were looking at a very bright medical future. But then what happened? Then we started losing track on many things, and we started developing another big threat. And I could say bigger than the one before, because we started looking at self-inflicted diseases. All of them are words that we hate, that we don't want to hear, that we don't want to see them around them. All of them are important diseases, like cancer, heart and vascular disease, which are the #1 killer in America, diabetes, Alzheimer's, high blood pressure, kidney disease, fatty liver. Everything affects everything. The lungs, the heart, the brain, the bones, everything. But the worst part of the whole thing, of the whole story, is that a lot of these diseases have a common origin. And that goes always inequivocally to our lifestyle. What we do, how we rest, what is our physical activity level, what we eat, etc. But it doesn't seem to dawn on us that all this is very important. I was just having a conversation this morning with a patient of ours who comes from Alaska. I love Alaska. I love the countryside. I love the people in Alaska. And we were talking about an episode they had at home because a big bear came their way and was very aggressive and so on. They finally had to shoot it. And when they shot the bear, of course, you just have a dead bear there. I wouldn't know what to do with it. And I asked, and what happens with the bear that you killed? And then they were telling me that you take the meat and they grind it and they made bear hamburgers. And I say, how does it taste? Is it good? Is it bad? In Alaska, they eat a lot of things. They eat moose, they eat bears, they eat a lot of things that we normally do not eat. Nevertheless, when talking about the bear, these people told me, it was a very good part of the year. We could have the meat. I said, what do you mean good time of the year? And they said, well, this is the time when you have all the forests in full bloom, and you have all the berries, and everything is surrounded by all these excellent fruits and berries and nuts and everything that the bear eats. So the meat is very good. It tastes very good. I said, is there a time when it's not good? She says, well, you have to be aware of bears that go into the cities and eat from dumpsters. Because as they eat all that garbage, the meat is unpleasant. It smells bad. It has a bad taste. You don't like it. You can tell. And I said, you're giving me a great idea. This is something I have to share with my audience. If you eat right, the meat is going to be palatable and good tasting and everything. If you eat your berries, your nuts, everything. But if you go to a dumpster, in other words, if you eat garbage, you're not going to have an unpleasant flavor or smell or anything like that, let alone health. That's how important it is. And that's why I want to talk about this. Now let me tell you, In the last few years, because of a lot of medical intervention and so on, some forms of cancers are beginning to decline. Good news! But don't go to any party yet. Because as we see the decline of the overall number in cancer, we're seeing an increasing number of cancer patients among the younger generation. So overall the numbers might look good, but we're looking at more and more people with cancer, younger and younger. And one cancer in particular, colorectal cancer, is rising. It's rising between 2 and 4% annually for the last 30 years. So imagine 2-4% per year over that period of time. It's a huge increase in colorectal cancer. What are we doing? This definitely has to ring a bell. This definitely has to be a cause of alarm. Okay, I'm an older person, I'm a senior citizen, and I might be in fairly good shape if I ever get cancer. But what about my son? What about my grandchildren? You see how important it is? That's why I want you to stay with me. You have to listen through because you're going to learn and hopefully change the way you live. My friends, we're talking about the big C word again. We're talking about cancer. And I'm never going to stop talking about cancer because I think I have a lot of answers to deal with it. But those answers are not going to happen unless you and I have this conversation. And unless you help me to spread the word. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And over 50 years, I go to a hospital every day. And I have seen cancer. I've seen cancer up close. I've seen it, how it can devastate a family, how it can devastate an individual, how dramatic the evolution of cancer can be. And I know I have tools, first and foremost, to prevent it. You do not want to get cancer, believe me. Even in the best of the cases, it's not fun to have cancer. It's not good to have cancer. And the numbers tell me more and more that I'm right. Statistics prove that yes, I can make changes in my life so I do not get cancer. So why don't I get all that in motion? Why don't I learn more about it? And this is something that we have to talk about. Education. We have to educate ourselves in order to know what to do and how to deal with our bodies so we do not get cancer in the first place. Then we have to learn about early detection, how to detect it as early as possible so we can manage it a lot easier with a lot more success. But today I'm talking about something that worries me a lot, that it's real cause for alarm. How the numbers of colorectal cancer, and this is very important, this is a very important cancer, is the number 3 of deadly cancers that are affecting us. After breast and prostate, Now colorectal cancer has managed to become the third most important cancer. And the worst part of the whole thing is that even though the overall numbers look good, the increase in the frequency, in the incidence of cancer, of colorectal cancer in particular, that we're mentioning today, is happening in individuals under 50 years old. Not only that, under 30 years old, we're seeing a staggering number of new cases. If you're 30 years old, you're planning your family, you're planning your life, you're beginning your first jobs, you're beginning to be really important, you're beginning to create the financial foundation of your whole life. You do not have time to get cancer. You do not have time to go to a hospital for radiotherapy. You do not have time to be out of work for weeks because you had surgery. You want to be healthy. But we have here several problems. One of them is that we do not really have, and this is where I want you to pay a lot of attention and share the word, talk to other people. We do not have any public campaign to detect in an early manner, in the right manner, colorectal cancer in younger people, because we don't think of it. We believe that young people are strong, beautiful, and healthy. They don't get degenerative diseases that are more proper from the old age. That's what we thought. But now we're seeing a huge increase in the number of cases of early onset colorectal cancer. It has certain differences from the other one. Colorectal cancer normally affects the right side of the gut, this more on the left side, but that's irrelevant to me. What's very important to me is to find an individual who's beginning to build their life, who's in their 30s, but all of a sudden starts developing some symptoms and nobody told him. That's the worst part. We're not telling our young people, be aware. Cancer might be getting close to you. The other part that really affects me is to think that if you develop cancer at 30 years of age, it's not really your responsibility. It is someone else's. And that person who's really at the beginning of the problem is somebody that should have taken care of you. Those are your parents. If your child develops cancer on an early onset, it probably means we didn't take care of this child as we should. So we have to learn. We have to educate ourselves. We have to think of that. And if you have children or grandchildren that are 20s, 30s years old, have a conversation with them. Have a conversation with your doctors and say, doctor, what can we do to detect in an early fashion colorectal cancer? And even your doctor might just take a non-blatant attitude like, oh, she's very young, we're not worried about that. You can go to the web, you can go to your doctor and ask, for example, for the new tests that are available. All they do is they take your poop and they look for cancer cells, for cancer DNA. You don't have to go through a very complicated study, but you have to think of it and you have to have a conversation with your doctor and you have to learn about it. If you don't, you might be missing a big chance to improve your health or to bypass completely a deadly disease. And as I have always said, if worse comes to worse and you get it, be able to detect it when it is a tiny little problem. When it's going to be less expensive, less suffering, and a lot more successful. But you have to think of it. That has to be part of your living strategy. And younger people do not tend to pay too much attention to this sort of podcasts. But if you do, tell your children about it. Sit at the table and have a little conversation. Doesn't take much. Have you noticed any change in your bowel movements? Have you noticed any pain, discomfort, and so forth? Don't take it very lightly. Talk to your doctor. See what tests you could do to have a very early detection of what could be a serious problem. I have already told you, 2 to 4% increase per year over the last 30 years. That's a lot of people, young people, in their 30s, 40s, or early 50s, developing early onset colorectal cancer. We have to do something. And that's what I want to tell you. And I'm going to show you how. That's why it's important that you listen to podcasts like this and that you get more and more information. If you watch me in the social media of your choice, I'm sure you're going to find links to other speakers, to other information, to dietary measurements, to physical activity improvements, to a lot of things that are going to be working on your behalf because they're going to be changing what? They're going to be going at the root of the problem, which is our lifestyle. Make no mistake, there is an unequivocal connection between how we live and how we will live. Simple as that. If we do things wrong, don't expect to be strong and healthy in the years to come. If we do wrong, you can expect to be with some sort of an illness. And we have said it many, many times. What sort of an illness? Well, the sort of illness that kills 7 out of 10 Americans. Self-inflicted chronic degenerative disease. That comes from simple things like what we eat, what is our physical activity level, what is our rest and sleep pattern, in other words, what is the attention we give to our bodies to function well. Because our bodies, like any other living organism, has a number of rules to go by. And those rules are going to keep you in the right track. If you break them, if you go astray, if you disobey them, you could have health consequences. And those health consequences could be very serious. And that's exactly where I do not want to see you. I want to be healthy. I'm going to be in good shape. I want to live a long, healthy, productive life. And to do that, you need to take care of this body of yours. This body that was entrusted to your care. And like any other living thing on earth, it needs care. It needs BioCare. And BioCare is what we're going to be talking in the next segments. And I want you to learn about it because once again, it can change your life. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I'm very happy to be with you. And I'm very happy to be able to have this conversation one-to-one, because I'm talking about something that to me is very important. It's dire important. We are looking at an increase in cancer numbers in the younger generation. We're talking about people that are 30 years old, 35, in their 40s, what we call early onset cancer. When you say juvenile whatever, when you say this is a disease that began early on life, no matter what, no matter how, it worries me a lot. Because when I see somebody and they tell me, for example, about someone, and they tell me, Dr. So-and-so or a friend of mine or something passed away on Wednesday and so forth, yeah, you feel sorry, you feel a little bit of loneliness, you're, but many times I think, well, he was 86, he was 90 years old, he had a fantastic life, he created a beautiful family, his children are successful and beautiful, and his grandchildren. Okay, I think there is a time to go. But then, when I see somebody that's very young, then that hurts me a lot. Particularly if the person that's leaving us already has his parents or her parents. Because I cannot begin to understand what you have to feel when you lose a child. And not only that, but that young person has a family, has children, has a mortgage, has so many things that you say, no, he cannot go. She cannot go. She's raising her children. She's raising her family. Both are working to pay the mortgage. What's going to happen to those children? What's going to happen with that family? A broken family is never a good thing. So what we have to do, we have to be responsible. And responsibility begins with self-care. Because if I'm the person that supports my family, if I bring the bread and butter, if I take care of everybody, if I guide them, if I watch them when they're sick, if I'm the guardian of this whole family, I have to make sure that I'm in good shape. And that I have seen, believe me, many, many times. Because being a caregiver has never been easy, even in the best of the cases. Even if you're well off, even if you have no problems or health problems, you still have to watch your family, you see what they do, you still have to guide them, you still have to advise them. You have a responsibility with all of them. But what happens when it comes to care? What happens when it comes to BioCare? And I love the word because it implies a very proactive verb, which is caring, that implies responsibility, knowledge. You cannot care if you ignore the subject. In order to be a proper caregiver, you have to know what you're doing. You have to know your goals. You want to know how to do it. You have to know what you need to be a good caregiver. And that begins from the minute we have one child. And when we have a child, we have to think that this person has to be very healthy and has to be very functional, because we want our child to live healthy and functional for the next 80 years. You do not want to have a child to get him through graduation, or just to his marriage, or just to her prom. No, you want a child that's going to bloom and function for the next 80 years at least. And to do that, that means BioCare. That means I have to know that I have a biological body, a beautiful baby that I have to care for, and if I have to learn how to do it. I have to know how to do it. In our time, there are a lot of resources to train yourself. But you can read my blogs, you can watch my podcasts, but you can call me. You can have a conversation. You can send me an email. Doctor, it's 3 o'clock in the morning and I have a baby like this, and you're talking about nutrition. And I'm telling you this, I'm not making this up because it happens, that people tell me. And I read that if I do this or if I do the other, this could be bad for the baby because he could develop allergies or he could have problems. But I saw that this and this, what is your opinion? It's not necessarily a consultation, but it's an opinion that hopefully will guide you. Or you might get a call of attention like, oh, you know, that thing you're telling me doesn't sound as simple as you tell me. You should check with your doctor. I think it's time to talk to the doctor, because many times we don't know when to go to the doctor. About any food, about anything, we have to learn. Let me give you a number that you probably know, you probably understand, you probably already have thought of it. Early onset colorectal cancer has been connected statistically to obesity in children. And again, the problem is not if you're fat or not. The problem is that obesity tells a story. And the story is that if you're obese as a child, you're probably eating the wrong stuff, the wrong amounts, and nobody really cares for you. If you have an obese child, nobody cares for you. Because if you really care for your children, you make sure they eat the good stuff. Just like the bear I was telling you. You eat your nuts, your berries, your good food. You don't go to a dumpster to buy food, which is what many people do. Why? Because they just want children filled, not fed. So, okay, shut up. You can have this junk food and stop bothering me, because I don't have time to cook, I don't have time to look for, I don't have time to make a salad, I don't have time to go to a market. I'm just fill you up and shut up. So if you're an obese child, chances are that the people you live with don't really take care of you. If they did, they would check matters differently, they would take you to a doctor, they would look for advice, and they would put a lot of time and effort in showing you a better way. So, early obesity or obesity during adolescence has been connected to early onset colorectal cancer. There's another good reason for that, and that is the intestinal flora. Obese children eat the wrong thing that does not feed the intestinal flora. And one of the functions of the intestinal flora is produce essential fatty acids, and some of them will block cancer cells from developing. If you don't have those good bacteria, you let cancer cells progress. Those same essential fatty acids, some of them will fight cancer, some of them will fight what? Diabetes. So if you have the wrong type of intestinal flora, your chances of developing both diabetes or early onset cancer are going to go way up. So if you develop cancer when you're young, it's because somebody at home didn't take good care of you. And that is BioCare. BioCare is getting involved, being very proactive in making sure that this living organism is going to develop strong and healthy. And that could be my pet, that could be a tree, that could be a rose bush, or it could be my child. I'm going to feed it well. I'm going to water it well. I'm going to make sure it rests well. I'm going to make sure that it gets physical activity. I'm going to make sure that grows beautiful and nice. And I'm going to look at my baby every day to see that it's developing well. And if I find something that's unusual, I'm going to ask somebody. I'm going to ask my mother-in-law. Remember that a grandmother is worth 10 pediatricians, as a good friend of mine always said. So I would ask anybody that knows more about childcare, but you have to show some interest. And that interest, of course, can take you to the doctor's office and say, the worst that could happen is that tell you everything is fine. And that's good news. But what if they tell you, oh, this is wrong, just beginning, we can solve it. And the more you get interested, the better off you're going to be. I know people that know a lot about cat food, or people that take fantastic care of their dogs. Yet the children are not under the same sort of standard. Early onset cancer comes from the hands of whoever took care of you. So if you're a parent, if you're a teacher, change. We need BioCare. I'm really having very good time. And I feel this is a very good time because I hope this is going to be a lot of good quality time. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I love the chance to be with you. I love the chance to be able to express myself in a lot of feelings of worry, of concern about what's happening to younger people. Cancer has been around me all my life. As a doctor, I had to face cancer from the beginning. But I have seen how things have changed. When I started medical school, when you talk about cancer, you always talk about an older person. You'd say, well, she had cancer, and how old is this person? And this was older people, 70s, if not 80s. You would not think of cancer in anybody under 50. I mean, let alone under 30. But things started to change. And then all of a sudden we started looking at people in their 60s. which was young for a cancer patient, and then 50s, and then 40s. And I have seen how sometimes I see somebody that looks very good, looks very beautiful, handsome, people that come to the office and sit down, and, hi, how are you? And how can I help you? And they say, well, I'm here because I was diagnosed with colorectal cancer, with breast cancer, where you're also looking at people very frequently very young. And you say, oh my God, I thought you came for anything else, not cancer. And then everything you do, you start looking at how cancer progresses in younger people. We have to remember that cancer is our own cells. It's not a bacteria like in infections. It's not a fungi. It's not anything like that. It is one of your own, very own cells that's wreaking havoc in your whole body. And that is because this cancer cell has been allowed to replicate, to prosper, and to create a tumor. What have we done wrong? What has happened? Well, believe me, a lot of the world research, a lot of the best oncological institutions in the world are after this question. Dana-Farber, National Institutes of Health, Massachusetts General, the big oncological centers in America are turning their eyes to the problem of early onset cancer, particularly colorectal cancer, that seems to be increasing and increasing in numbers in the younger generation. Those of us that are in the last part of our lives seem to be spared. But the younger people, 30 years old, 40 years old, 50 years old, are getting increasing numbers of cancer incidents. And they say, well, that is because we don't have really good programs for early detection on younger people for cancer, because we don't think of cancer in young people. Now we have to start thinking about it. If you're 35 years old, you're not excluded from thinking of cancer, from visiting a doctor, from doing tests. And I was telling you that there are coming new tests where you don't really have to do anything other than send poop to be analyzed for cancer cells. And then you go to more important studies. But the first step is very simple. You can do it from home. So all you have to do is think of it. And then see where the problem might be coming from. And I was telling you that obesity as a child or adolescent is a problem. Sweetened beverages have been explicitly pointed at as one of the culprits of colorectal cancer. Sweetened beverages. Dr. Atkins, who was very famous some years ago about the Atkins diet, and he was a very important physician in the metabolic medical world, he always said, remember, every time you have a soft drink, all your body was asking for is a glass of water. If you keep that phrase in your head, that can help you a lot. If you're thirsty, all you need is a glass of water. Skip sweetened. It doesn't matter what you sweeten it with. Sugar, fructose, worse. Non-caloric sweeteners, even worse. This has been proven. I'm not saying it. I'm not making it up. Sweetened beverages are toxic. Don't take them. Just have water. That's what you need. And then the other problem is the lack of physical activity. When we start doing physical activity, it has a lot of very important metabolic consequences. Just think of this for a couple of seconds. It doesn't take too much. Out of your body weight, 2/3, 2 full thirds of your body weight are muscle. That means that a lot of us are muscle. All you have to go is go to the butcher's, and you see that beef thing hanging, and you see meat all over, meat from here to there. But when you look at the organs, they're here: the lungs, the stomach, the heart, etc. That's only 1/3 of the whole animal. Well, same with us. 2/3 of our body weight is muscle. So whatever the muscle does has very important metabolic repercussions in the rest of the body. If we move the muscles are going to increase caloric expenditure, protein synthesis. This is something that very few people understand. We grow when we exercise. We become stronger when we exercise. We create better tissue when we exercise because muscle activity has that metabolic capacity. And being such a huge, important part of our body, 2/3 of our body weight, it can have universal, important consequences if you exercise or if you do not exercise. So, applying weight to your muscles, moving, going upstairs, downstairs, vacuum cleaning your house, using a broom, mowing your garden, whatever you want to do, but move. So those muscles can keep you healthy. So with those two things in mind, plus the sugary beverages, you could be helping a lot. You could be changing the life and the future of your children. And BioCare is fundamental. To understand that we have to take care of a biological body and how we have to do it. And BioCare is our first name. BioCare is something we know how to do. BioCare has been implemented with the backing of a hospital. In other words, we're putting together all our metabolic knowledge, all our integrative medical knowledge, all our nutritional knowledge with medical modalities. We are a full hospital. We can do things you cannot do in a gym or at home. And we can put everything together. And I invite you, first and foremost, to follow me. I invite you to ask questions, to send your comments, to email me, to call me. I'll be very happy to help you. There's no charge whatsoever. I'll be happy to help you and guide you. And third, I invite you to plan a health getaway. I invite you to say, I want to be in a place where I can have full diagnosis, full intestinal flora management and restoration. I want to have oxidative therapies like hyperbaric oxygen and ozone and all these good things that can change your life. And I invite you to put all this in perspective. In one shot, you come to BioCare Hospital for 10 days, 2 weeks, that can change your life for better. You're going to make sure where you are at any given point, make sure how your body is working, make sure what are your standards of health at this point, and improve them. Not only improve them, but look at them over long period of time. Give me 10 days, I'll give you 10 days, 10 years of well-being. So BioCare can be your answer. Have a health getaway and we can change your life. Call me, follow me, stay with me, because I will always have a message for you. And thank you for having me in today.